So I guess we will go on to Stephanie Peters.
Right.
Stephanie is, and ask Pablo to stop sharing his screen and ask Stephanie to start sharing his screen while I introduce Stephanie. She is founder and CEO of enABLE Care Management based in San Mateo. And it didn't occur to me until I got on enABLE's email list that care managers can connect you with whatever type of expert you need, kind of like fiduciaries. In fact, enABLE has a registered dietitian, I think, on staff, and they can connect you with trainers, therapists, organizers, whatever you need. enABLE even has a caregiver support group on Wednesdays that's open to anybody. And I love the name. It's called Champions of Chaos. So, Stephanie, tell us more.
Thank you so much. It's nice to see everyone virtually. I'm Steph Peters. I'm very grateful to be here, and I hope that I can share with you enough about what a care manager is and how we can help so that you can decide if care management is right for you and your situation. So I am the founder of enABLE, and the best way I've found to describe what care management is we're basically the expert adult child for hire. What typically falls on the adult children and or the spouse, or both, caring for an aging loved one or through a disease progression. We are trained to either help advise through that or in some cases handle it for them. One important distinction, especially between us and like what a fiduciary, like what Pablo talked about, is we are not decision makers. So in the event that we work with a client who doesn't have a power of attorney in place or someone to pay their bills for them, we would bring in a Pablo to make sure that somebody is calling the shots. Our job is to recommend different options. So essentially a care manager comes in, they assess the situation, where are we now, what's going on in all the different facets of life, kind of like a puzzle. And we listen to the goals. So because we're not decision makers, we really only care about what's best for our clients and their families and helping them reach their goals. That's our sole purpose at enABLE. So we come in, we assess, we understand what the goals are, and then we basically create a plan to get there, which includes resources, options, education around all the different options so that you can make the best decision for you and your family. And then we just help you execute it. And we do that on repeat over and over and over for a client as many times as is needed, because as everybody on this call likely knows, if you're going through a disease progression, there is constant change. And so we just do it over and over and over. We pivot where we have to. We bring in other resources as needed. We offer suggestions that have worked in the past. And we basically just guide you through life. And hopefully a win for us is you and your loved one reaching your goals. That really should be the driving force of a care manager. So we have clients, a care manager could have clients who have no support system, and we are literally calling Pablo and saying, can you come in? Can you be power of attorney? Can you manage the finances? And we need to get a doctor and make sure they have the right caregivers, and we can help manage all of that. And then we have some clients who have an extensive support network, and that support network either can't get on the same page or have said, we want to spend our time just having a cup of coffee, not coordinating all the caregivers coming in and out. So they outsource that piece to us, and we're happy to do that. For us, whatever makes you and your loved one happy and however we can contribute to that, that is our role. So I hope that's like setting the stage a little bit. Most people don't understand care management, so don't feel bad if you're still like, I don't know what she's talking about. The reason I put this slide, for you to be able to choose the right care management company or care manager for you, I think it's really important to understand our industry, which is relatively small. We're not necessarily new. We've been around about 30 to 35 years, but there aren't a ton of us across the nation. And we only have one association. It's called the Aging Life Care Association. And the reason that matters is there is no federal or state legislation or licensing for our industry at this time. I think it's coming, but it's not here yet. And that matters for you because literally anyone could decide, I want to be a care manager, I'm going to open a business, and I'm going to provide care management. And some who do that are fantastic, and some are not. I personally always advocate for people to go through the Aging Life Care Association because at the very least, those people who are listed as members have met certain requirements. If you get an advanced professional, and I'll show you on the next slide how to find that, then that person is actually certified to do care management work, and they've paid fees to be part of it, and they've opened themselves up for their peers in the Aging Life Care Association to address whether or not they're adhering to a strict code of ethics and standards of practice. So personally, the safest way I can guide people to find a good care manager is to say, go through the Aging Life Care Association. So I call it ALCA. ALCA says that we are to be credentialed, experienced professionals skilled in providing personalized decision-making and support. Again, to be clear, our job is to say, okay, you are facing this difficulty within whatever, your home isn't safe, you keep falling. My loved one keeps falling. Okay, we've got the obstacle that we're trying to combat. What's the goal? The goal is for us to stay home as long as possible. Fantastic. Let me do some research and come to you with all of the different options, walk you through what it looks like. You make a decision and say, Steph, we want this one. I go make that happen for you, or we do it together. In a nutshell, that's care management. And I think it's really important to make sure that you get someone who is credentialed to do this work. So how to find a care manager. As I mentioned, aginglifecare.org is our one association. You just go to the website, click on the orange button that says find an aging life care expert. You can filter by zip code, county, city, whatever you need. We are all across the nation, but there aren't a ton of us. And there are some areas where care managers don't exist, but there are a bunch of us that are trying to offer virtual consultations so that we can still at least give you guidance over the phone. We just can't quite be boots on the ground for you in those areas. And look for the advanced professional. The advanced professional is going to have the CMC, those initials behind their name. That means they took the test to be certified as a care manager. They passed, and they are in good standing with ALCA. Some questions to ask: how exactly do we work? Most care management companies work like attorneys, where we have an hourly rate, kind of similar to how Pablo explained. You just pay for the work that we do. I know some of my colleagues across the country have a retainer. You like an attorney, you pay up front, they work it off. Some have introduced like a flat fee model. It's a certain amount per month and you get a certain amount of hours. It's all different because we aren't highly regulated. So when you call to vet a care management agency, you definitely want to ask questions around their billing practice. Care management is a concierge service. So you do want to make sure you understand, do you charge for drive time? Do you come to me, or is this fully virtual? Do you have a weekly or monthly minimum? Is there a maximum? Do you charge for mileage? You just want to understand what that really looks like. You want to make sure that you're asking if someone in their agency, or if they're a solo practitioner, if that person has experience with your particular disease. Obviously for this call, it would be Parkinson's disease, and understanding the treatments, the specialties with physicians, what all of that looks like, because you're paying for the expertise. You're paying for someone to know, because you don't know what you don't know. So you're paying for a care manager to know for you and to help guide you through and to help you ideally avoid crisis or pitfalls. Definitely ask the care management practice if there are family support resources and other opportunities that they offer in terms of support for your aging loved one or for yourself. And most importantly, you want to look for the personality and style fit. So care managers really become part of the team, part of the family in a lot of cases. We're really that trusted advocate. So it's really important that if someone is highly detailed in their communication and that's going to drive you crazy, that you kind of suss that out up front. That's also where it can be really helpful to find an agency with multiple care managers rather than a solo practitioner, because in the event it isn't working, or sometimes individuals with memory impairment, a change of face is really helpful. There are multiple members of the team who can collaborate together to just move the needle. So these are just considerations to think about when looking for a care manager. So what services do care managers provide? According to ALCA, we are supposed to be experts in these different areas: legal, crisis intervention, health and disability, financial, housing, family, local resources, and advocacy. Essentially, we are to come in, again, assess the situation, know enough to identify what is needed to complete the picture and get you towards your goals. And if we can't provide it in-house, our job is to get someone for you, vet them for you, and bring them to you as an option. But again, we don't make decisions. We just would say, for example, in my professional opinion, it might be a great idea to see if we can get an order for home health in here, have some PT to work on mobility, and then maybe an exercise therapist continues when that stops. That's just one option. Our job would be to present that to you, just as an example. This is not a plug for enABLE. This is to highlight that because we aren't highly regulated, every agency honestly is so different. And we all have our different specialties, our areas of focus. So at enABLE, we have the team approach. As Denise mentioned, I have a nurse who can manage medications. I have a registered dietitian who can come in and meal plan and look at menus and grocery shopping. I have a home safety specialist who can come in and look at the home and maybe have some equipment interventions that might help keep the person safely at home for longer. But that's how we do it. And every agency is different. And so it's really important to make sure you're asking those questions. What are your specialties? Is there anything different than you offer than enABLE, so that I can make the decision that's right for me and my family? And this is a super long list that elaborates on the 8 areas ALCA says we are to be experts for the most part. These are all of the things that we can help you with. And again, when we can't do it, our whole job is to reach out to our partners, a caregiving partner, an assisted living specialist like David's about to talk to us, Pablo coming in. Our job is to all collaborate together and make sure everything is moving the way it should. So I wanted to leave you with this visual. I hope that it expresses what the main goal of a care manager should be and how they can help a family coping with an individual with Parkinson's disease. It can be incredibly overwhelming, just helping someone through the aging process, let alone through a disease progression. And I think it's really important to know that you don't have to do it alone. And a care manager should lighten your load. They should bring you peace of mind. A care manager should be your eyes and ears when you can't do it, should supplement your eyes and ears when you just want to be sure you're seeing everything correctly or seeing what you should be seeing, or taking that load off of your plate. That thing, when I talk to families, there's always a thing that the main responsible party I'm talking to is like, I just can't deal with long-term care insurance companies. That's always a big one. I just can't handle the medical system and this specialist. I can't get a hold of them. I can't get an appointment. Give that to us. Give that to a care manager to do for you, so that maybe you can just enjoy a cup of coffee with your loved one and like chat with them. Give us the other things to coordinate for you. That is the primary way that a care manager can help you, as well as advocating for the loved one so that their voice doesn't get lost, and helping hopefully to avoid crisis and pitfalls, because we've been through it with thousands of clients. So hopefully we've learned something that can just be super helpful when you don't know what you don't know. And that's it. Any questions?
Yes, if you have a question for Stephanie, type it in the chat or use the Q&A feature, and we will answer it. So my question for everybody is about the fee schedule. I'm sure that you already told me enABLE is hourly, right?
We offer both. So we have an hourly fee structure, and we also have a flat fee model that would be
Okay.
all inclusive, which we found is really helpful for individuals who need to budget or who just need kind of some guidance, but not necessarily us going to visit every single week.
Okay.
That just came out of need. So we created that. Mhm.
Right. And I think the hourly fee was 175,
We're at 250. So
250. Oh,
yeah,
that was right. It went up recently.
the
Yeah.
range in the Bay Area that I've heard, honestly, anywhere from 150 to 325. The Bay
Yeah.
Area is the Bay Area.
Yeah. Depends on your zip code, right?
Yes.
And I imagine that the flat fee, kind of like hourly, is based on how much the family thinks service they're going to need. So it's a flat fee, and you get this many hours
Sort
per
of. We
month.
try to tie it more to outcomes, right? So if you come to us and you're like, these are the things we need, we have everything else, we
Mhm.
might be able to identify that we can meet those outcomes for you in a flat fee. And we try not to tie it to hours, because what I don't want is, can you go visit my mom? Oh, sorry, I only have a half an hour left this month. Can I do it next month? We don't really work that way. It's more,
Yeah.
if that moves the outcome needle, then yeah, we can do that.
Yeah. And how about family meetings? It's nearly impossible to really run a good family meeting. Can enABLE do that? And can you kind of talk about why it might be helpful to have a family meeting?
Yes. So we are trained mediators out of need.
Excellent. Yes.
Families are awesome and families can be difficult. All families, my own family, I'm just sometimes banging my head against a wall. So it can be incredibly helpful to have an outside objective party just hearing everybody, creating structure for a meeting. We actually have ground rules that we will put in place at the start of the meeting. And our job is to kind of referee and make sure everyone is adhering to the rules so that everyone can be heard. And ideally, a group consensus can be reached.
Mhm.
And that's like 90% of our job is
Yeah.
navigating the family dynamic.
And just, out of curiosity, I haven't had a family meeting myself, but is it is it likely for some groups of people, some families, that having the mediator present kind of brings the level of emotions down and keeps people's behavior a little bit in check?
Yes, for sure.
Yeah.
Right. You can imagine, I think of it, not that I'm in any way equating adults to children, but my kids, I have little kids, and you better believe when we have guests over, they're so much more polite than when it's just the four of us sitting at the dinner
Yeah.
table. It's just human behavior.
Yeah. So maybe a really good idea to get a mediator and have a family
Yeah.
meeting.
For sure. And that's the beauty of mediation. We're not lawyers. It's not a legal entity. You're not signing legal documents. We are just trained in making sure that everyone feels heard. And one thing that I have learned in my tenure as a mediator is there is always a why behind whatever is happening. Always. And it's just a matter of someone taking the time to figure out what is that why that is causing this behavior or this conflict or this miscommunication. And most of the time, if that why can be heard and satisfied, the whole thing just drops away and we can move forward.
Yeah, and if a family member's asking why, you get a whole lot of
Yeah,
get a
exactly.
stranger to ask that
Right.
question. Yeah. Robin has put a question in the chat. She said, "Would you always want to be hired by the healthcare proxy?" I'm not sure what that means.
I think I understand. Robin, do you want to elaborate, or I think I understand the question.
I'm just asking about the healthcare power of attorney. Would that always be your point person within the family?
Great question.
Oh,
Yes,
yeah.
excellent question. So at the end of the day, whoever is listed on the legal documents has the final say, unless they have put in writing to us, yes, I'm the legal power of attorney, but my sister can make all healthcare decisions. Put it in writing to us. As long as both sisters are okay with it, then we can do that. But yes, at the end of the day, most of the time we don't have to get that granular of who is the final decision maker. We need to know, and we always collect that upon intake and assessment and onboarding with us. But most of the time, it doesn't have to go that far. But yes, we have to know who that person is regardless, even if the person still has capacity to speak for themselves. Upon intake with us, if there isn't power of attorney, even if the person still can make their own decisions, one of the requirements for us is that within the first 90 days, they get that completed. And that's where we might call a Pablo and say, you know, we haven't identified anyone else. Would you be willing to talk to this person and become that for them? Because we are not decision makers, we have to have someone. And in the event this person can't speak for themselves anymore, who is that person?
Mm-hmm. Mm-hmm. I think a lot of people might feel like if they hired a care manager, then they are, you know, obligated to stay with that service, and it would get to be too expensive. So do you have long-term clients and also really short-term clients both? And is that okay with you?
Yes. I mean, we love every client that we've had, even the ones that have been, you know, have needed a lot of our attention. We still love them. So of course we want to stay involved as long as is appropriate. We are set up to be involved long-term, but we have also out of need heard from our clients, you know, I really only need you to help me with this. So we have project-based packages where we're only involved in a short amount of time. You aren't signing up for, I mean, we're month to month. You only pay for what you use us. The only stipulation we have on that is we have some clients that use us in the beginning, then we do our job and things calm way down and they stop service with us. And then they'll call when a crisis happens and say, okay, can you run to the hospital? No, I can't. I don't know what's happened in the last 6 months. How could I possibly advocate for you and your mom? So that's the only thing. If you want to use us as that like crisis intervention, we do need to be kept up to speed. But certainly we have people who use us specifically just for like one project, for example, and we do that for them. And then we tell them, call us if you need us again.
Yeah. Yeah. Oh, good thing to know about not being able to jump back into a crisis because you don't know what's going on. That's a really good point.
Yeah.
Yeah.
We have to know, you know, just a little. So that's where we have a lower tiered service that you can stay as a client of ours and keep us in the loop. So we call it the peace of mind service. So that when a crisis happens, you have peace of mind that you can call us and we can mobilize quickly. And then you can just kind of bump back up to the other tiered service.
Yeah, I think that's one of the things caregivers sometimes think, oh, I'll get in-home care when I need it. And the in-home care can't actually start today because they don't know you or the situation, what's going on. So Laura's going to talk a little bit about that a little bit later. But if we don't have any more questions, I don't see any more in the chat. I'll ask Stephanie to stop sharing her screen and ask David Cohen if he will start sharing his screen and tell you a little bit about David while he does that.